Yeah, so my name is Chloe Hundman. I am a fourth year med-peds resident at the University of Tennessee Health Science Center in Memphis. I am sharing an interesting case that my team had, and I've titled it Palliative Dual Stenting in Advanced Esophageal Cancer Necrotizing through the Mediastinum. So to get started, my learning objectives for today are to first understand that forming a multidisciplinary team involving gastroenterology, interventional pulmonology, and palliative care can be very beneficial for any patient with advanced esophageal cancer. And then next, recognizing that dual stenting is a safe and proven approach to palliatively treating patients with advanced esophageal cancer. So to get started, bronchoesophageal fistulas develop in 5 to 10% of patients with advanced esophageal cancer. Why is this important? Esophageal cancer affects many patients in the United States, but even more so around the world. It's actually the sixth leading cause of cancer across the world. My case presentation was a 59-year-old male with history of tobacco use. He actually admitted to smoking for about 20 pack years. He presented to the emergency room with productive cough, fatigue, dyspnea, and weight loss. His CT chest showed a mid-esophageal rupture communicating with the right pleura, loculated right pleural effusion, and collapsed right, middle, and lower lobes. The esophagram showed barium spilling into the right, middle, and lower lobes. And his EGG showed an 8-centimeter mid-esophageal lesion with a 2-centimeter fistula opening. This tract tapered down into a 7-millimeter opening into the mediastinal cavity. So when we were trying to figure out what we were going to do, we turned to the literature, and unfortunately, patients with advanced esophageal cancer end up typically only surviving 4 to 6 months. And so really palliative options are the mainstay of treatment. And so we found that dual stenting of the airway and the esophagus is shown to be superior to single stenting for both palliation and safety. And the majority of patients who receive dual stenting in advanced esophageal cancer are able to breathe and swallow until shortly before their death. And so given these risks of pneumomediastinum and the patient's desire to eat, palliative stenting of the esophagus and the right bronchus intermedius was performed. GI first went in and placed a fluoroscopic guided Merit Endomax stent, and then actually ended up placing a second superiorly placed telescoping stent. So you can see that right here, kind of in the CT scan. And then interventional pulmonology went in and placed a tracheobronchial stent over the fistula in the right bronchus intermedius. And so the patient tolerated this procedure really well. And 4 days later, he was able to transition to a CHOP diet and ended up being able to eat for the next 7 months before his disease. He eventually came to his disease, but we were really thankful for this case, and it was a great case to kind of highlight this palliative option that this patient had. So.